A person can tell you, no, there are other women who cannot have kids, so just accept the fact that we have one. It's hard because it's not my fault. This was taken away from me. This was stolen away from me. Will I ever get married in my situation? Will I ever find a person who's going to accept me?
Katlego Mpiana was just 22 years old when she gave birth to her daughter in 2013. She was rushed to the Mamelodi hospital after experiencing pain, and that's where she says her uterus was ripped out of her. She says this happened without her consent. The Gauteng Health Department has confirmed that she was at the hospital for some time in July 2013 after giving birth there. The hospital insists she signed a consent form before her womb was removed, but that's not how Mpiana recalls the events.
The next thing I remember, they had this pad next to me. They held it they're next to me, and then they gave me a pen to write out my name. I was like, I can't write because I'm weak. I just lost a lot of blood. I can't write, I'm weak. So they made me write my name. And then if you were to see on the form, I wrote it just going up there because I couldn't write properly. They made me write it. And then from there, they took me to ICU.
She is not the only woman who claims to have experienced this problem. Bongegile Msibi says she had the same experience 13 years ago. Her case allegedly took place here at the Chris Hani Baragwanath Hospital in Soweto. She only found out in 2016 that she no longer had a womb when she was trying to conceive again. She's been trying to fight the case since then. Msibi says her pleas for help from different institutions have gone unanswered.
I am not going to accept the fact that I don't have a uterus. I want answers. I want to know. I want whoever that is responsible for that to be held accountable. I want them jailed because they took away so much from me. It can never be replaced. No amount of money will ever replace what they've taken away from me.
Many health unions and civil society organizations have marched on hospitals and health departments through the years, demanding better conditions. They all agree that while the country's health system has slightly improved, some issues have never been resolved, while others are persisting or getting worse. President Cyril Ramaphosa is expected to address issues of medical legal claims and staff shortages in the health section of his State of the Nation address.
There are a number of issues. We've got frozen posts. You go to clinics, to hospitals, you find out that there are not enough doctors, there are not enough nurses. In some provinces, you will be told that the only person who's got powers for advert of new post is the Superintendent General or the HOD. What we are calling for is to say we want these posts to be unfrozen so that we can hire new nurses and new doctors. But we need to have clear time frames to say from this date to this date, this is what is going to happen so that we don't entertain wish lists.
The president is also expected to touch extensively on Minister Aaron Motsoaledi's National Health Insurance Plan, with some saying NHI still needs to be thoroughly scrutinized before it can be implemented.
NHI remains a bit of a mystery. It's been discussed for 10 years. We've had various iterations of various documents. Each document becomes less and less specific and more political. Our big concern is that while there is discussion of financing, and health financing is a huge problem, there is inequitable financing, that's not even a matter of debate, there isn't a discussion of quality.
Some have also questioned how the government can be expected to look after the country's health when it can't even make sure buildings housing its employees are compliant with standard health requirements. The Gauteng Health Department is a case in point. The department's headquarters caught fire in 2018, killing 3 firefighters.
Our overarching point really about our government and the state is that they are not investing on health. And remember that any country that doesn't value or invest on health, it deserves no future because its society will die. And that will have a bearing to all other phenomena like your economy, politics, and all other social realities. So our real concern is that we want a government who pays a close attention to health for us to move forward.
With medical negligence cases on the rise in the country, South Africans are becoming more and more fearful of using public health facilities. Gauteng is second after the Eastern Cape with such cases. The two provinces have spent billions of rands in paying out claimants. The two women we spoke to found each other through a support group they formed with several others who've survived medical negligence across the country.
I was crushed because I want to be a mother again. You know, I want to have solid feet like other women. I don't even know how much a pregnancy test costs because I don't use it. I don't need to use it. I don't know. You can't explain the feeling, and it'll never go away.
They say they will never trust the public health system again. Masego Ratlaga, Johannesburg.